Here.
Russ Childers,
Here.
Roger Folsom,
Here.
Anthony Williamson,
Here.
Mark Trail, Russell Crutchfield,
Present.
David Cruz,
Here.
and we will note that we have one member that will not be in attendance, Mark Trail. Thank you, Chairman.
Yes, thank you, Denisha. We have a quorum, and thank everyone for joining us this morning. I'm doing the call here this morning from the boardroom along with the commissioner. So appreciate everybody being on the WebEx or the phone. I understand Russ Childers got some problems down his way in Americas, but glad you could join us on the phone there, Russ. This morning we have 4 items to review on the agenda and vote on for final approval. I remind everyone that when you're not speaking, please mute your phones as we have in the past. So with that, I'll call the meeting to order. And the first on the agenda are the ask Elena Cummings, our secretary, if she's read the minutes for the August 13 meeting and recommending approval.
Thank you, Chairman Boyd. I have reviewed the minutes from the August 13th meeting and find them to be accurate as written and would make a motion to approve.
Motion's been made for approval of those minutes from the August 13 meeting. Is there a second to that motion?
Crutchfield, second.
Is there a second to the motion?
Russell Crutchfield, second.
Russell Crutchfield has seconded that motion. All in favor say aye.
Aye. Aye.
Opposed? Abstaining? Hearing none, they are approved. Thank you, Elena. And now the same thing for the August 27 meeting. Have you read the minutes and are you recommending those for approval?
Yes, Chairman Boyd, I have reviewed the minutes for the August 27th meeting and find them to be accurate as written and make a motion to approve.
Is there a second to that?
Second, Russ.
Russ Childers has seconded that motion. All in favor say aye.
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 Abstaining? Hearing none, they are approved. Thank you, Elena. Next on the agenda, we're going to ask Russ Childers to give us a report on the audit committee meeting that I believe was held earlier this morning. So would you please go ahead, Russ?
Yes, it was, Chairman Boyd. Mark Trail wasn't able to join us, but the other 3 of us had a good meeting. We received some rather detailed reports, and it'll take a while to take a look at them and absorb all the information, but very good information, and look forward to looking through that more. And we'll have another audit committee this next month to review the budget for this year and that kind of thing. Thank you very much.
Thank you, Russ. Are there any questions for Russ pertaining to the audit committee meeting? Any board members have questions or comments? Hearing none, we'll move to the, thanks, Russ, and we will move to the commissioner's report, and I'll turn it over to Commissioner Berry.
Good morning, Mr. Chairman and members of the board. They say that repetition is the key to good communication, so I'm going to try this one more time in case people haven't gotten the message. To those frontline workers, nurses and doctors and respiratory therapists who are doing all of the work in our hospital settings across the state of Georgia, we at the department want to thank you. We cannot be more grateful for the work that you're doing to keep our citizens safe and our family members safe. So thank you very, very much. I also want to take a moment to thank the teachers who are now back in school and are teaching our children and educating our children. For them to be back in person is remarkable, and what a job that they're doing. So thank you very much to teachers, many of whom get their health insurance through our department. And so We have a special bond and relationship with teachers and educators across the state. And so thank you very, very much. We continue to manage the crisis remotely. There's a small core group of people that come into the office pretty regularly. But besides that, we are asking our team to work remotely. We have daily calls with a significant number of our team members. The work continues, and I couldn't be more proud of the team at DCH for what they're doing. I know that there are times when some of this work can be overwhelming to some of our divisions, and I just want them to know we support you 100% and couldn't be more pleased with the work that you're doing on behalf of the department and to provide easy access to health care for people around the state. And for our board members, I know that when we're doing this remotely, I'm grateful that Chairman Boyd has come in today. It's hard to stay committed when you're not seeing each other face to face. And so to have such a board that is actively engaged and has been all the way back to March, we recognize that and want to give you all the appropriate applause for staying engaged with us and reaching out when needed. Your support as a board member does not go unnoticed. So thank you very much. Mr. Chairman, I'll turn it back over to you. Can answer any questions that you have.
Thank you, Commissioner. And as chairman of the board, I'd add some comments to reach out and recognize again, as you have the folks here at DCH that have worked tirelessly through this crisis era and some difficult circumstances and continue to do a yeoman's job. And so many times what we see on the outside is any negatives there may be, but never hear the positives and the thanks to the people that are doing such great work. And just wanted to pass that along, that we very much do recognize that as well, Commissioner, that your folks are doing.
Thank you.
Are there any questions for the Commissioner? Any comments from the board? Hearing none, I'd like to move into the items on the agenda that we will be asked to vote on for final adoption. And Kim Morris, Director of Reimbursement and Financial Management, will present those items, starting with the Medicaid rate increase for nursing home mechanized ventilator care programs, and this will be for final adoption. We have already previously seen this and passed initial adoption, and then it's gone out for public comment, which is our process. And so, Kim, you may proceed with your presentation.
Good morning, Chairman Board, Commissioner Berry, and members of the team. Today I'm presenting for your final approval a request to increase the Medicare per diem for the nursing home mechanical ventilator care with an effective date of July 1, 2020. Public comments were held on August 18, 2020, and written comments were due on or before August 25th, 2020. There were no public comments received. We did receive one written comment from Donna Knackers, Vice President of Reimbursement, Georgia Healthcare Association. The commenter supports the rate increase, which would assist nursing centers to address the rising cost of equipment. DCH agrees with the comments, and there were no other written comments. I'll pause briefly to see if there were any questions from the board members.
Any questions, comments from the board, please?
Hearing no questions, I ask the board for final approval to increase the Medicare per diem for the nursing home mechanical ventilator care with an effective date of July 1, 2020.
Do I hear a motion for approval?
Chairman Boyd, this is Elena Cummings. I motion to approve.
Is there a second to that motion?
David Cruz, a second.
David Cruz has seconded that. And all in favor say aye.
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 Opposed? Abstentions? Hearing none, it is approved. Kim, you may proceed to your next item, please.
Okay, so the next item is to seek final approval for a request to add a new CPT code, code D1354 for Silva Dynamite Fluoride as a covered dental procedure with an effective date of January 1, 2021. Opportunities for public comments were held on August the 18th. Written comments were due on or before August the 25th. There were no public or written comments received. At this time, I'll ask the board if there are any questions.
Any questions or comments from the board? Hearing none, is there a motion for approval for final adoption?
This is Folsom, Chairman Boyd. I would move for approval.
Roger Folsom has moved for approval. Is there a second to that motion?
Russell Crutchfield, second.
Russell Crutchfield has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved.
Okay, thank you.
You may
Also-
proceed.
Okay, also requesting final approval for a 1% rate increase for the fee for service for 100 primary codes with an effective date of July 1. An opportunity for public comments was held on August 20, 2020. Written comments were due on or before August 27th. There were no public or written comments. At this time, I ask the board if there are any questions. If there are no questions, I'll ask for final approval.
Are there any questions or comments from the board, please? Hearing none, is there a motion for final adoption?
Ken Davis, I'll make a motion.
Dr. Davis has made the motion for approval. Is there a second?
Russ Childers, second.
Russ Childers has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. And Kim, you may proceed to your final item.
The final item for initial approval is to request to add a financial quality incentive to the nursing home per diem with an effective date of July 1, 2020. Public comments were held on August 20, 2020. Written comments were due on or before August 27, 2020. We received one oral comment that was from Kimberly Clausen, Senior Associate Director, Payer Relations for the Joint Commission. We received 4 written comments. Donna Knackers, Vice President of Reimbursement, Georgia Healthcare Association. Kim McRae, President, and Walter Coffer, Managing Partner with WD International Consulting. Kimberly Clausen, Senior Associate Director, Payer Relations, the Joint Commission. Dee Cato, Chief Executive Officer, AG Rhodes. Several commenters were in favor of the new quality incentive for nursing homes. DCH did not have any response. We received a public comment regarding equating the Joint Commission accreditation to the ACH Bronze Award. The written and oral comments requested that Joint Commission accreditation be recognized at the highest award level with the AHCA Gold Award. Per comments received, the ACH Bronze Award recipients must demonstrate a commitment to quality, and the comment attribute said that was in line with the Joint Commission. After reviewing of the comments and the required compliance to become Joint Commission accredited, DCH agreed with the commenter and will recognize the Joint Commission accreditation at the highest award level, and it would be placed at the same award level as the AHCA Gold Award. We also received a written comment asking us to consider adding the Eden Registry to the current award type level. DCH's response is why there are other national registries that focus on improving quality of care and quality of life in nursing homes. DCH will at this time focus on the 2 quality awards listed in the public notice. If there are no questions from the board, I ask for final approval to add the financial quality incentive to the nursing home per diem with an effective date of July 1, 2020.
Are there questions or comments from the board? Hearing none, and I think, Kim, when you started out there, you said this is initial adoption and then you clarified, but it actually is for final adoption. Am I correct?
Yes, that is correct. It's final adoption.
Is there a motion for approval for final adoption?
Russell Crutchfield moved to pass.
Russell Crutchfield has moved for final adoption. Is there a second?
Roger Folsom, second.
Roger Folsom has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you so much, Kim, for your presentation today, and also thank you. I know that the work that goes into this, and thank you for providing all the information to us on the public notice and so on that we've had a chance to review before the presentation today. So thank you for that work, and that concludes our agenda here today for items that we needed to vote on. Next, is there anyone know of any new business that needs to come before the board at this time? Hearing none, the meeting is adjourned, and I remind you that our next meeting will be on October 8th at 10:30 a.m. Thank you all so very much for joining us today and participating, and you all have a good day. Goodbye.